Hi there, my name is Jenny Shula. I'm a clinical pharmacist at Mayo Clinic in Rochester, Minnesota. I will be discussing our paper entitled Pharmacotherapy Approaches in Non-Tuberculosis Mycobacteria Infections from the Mayo Clinic Proceedings. Non-tuberculosis mycobacteria infections have made the news several times recently with reports of various clusters of mycobacteria infections, from heater-cooler devices used in cardiothoracic surgery to a cosmetic surgery outbreak in the Dominican Republic to a multi-state outbreak associated with tattooing. Non-tuberculosis mycobacteria infections, or NTM as they are often referred to, are being increasingly recognized clinically as well as identified with advancements in laboratory diagnostic capabilities. These infections can be a very difficult disease to manage due to antimicrobial resistance, frequent antimicrobial intolerances and toxicities, drug-drug interactions, and the prolonged duration for treatment required due to the slow-growing nature of mycobacteria, as well as patient comorbid conditions that can make it even more challenging. I should note that unlike mycobacteria tuberculosis, the correlation of antimicrobial susceptibility tests results and the clinical outcomes can be variable depending on the NTM species and the specific antimicrobial agent tested. We discussed this briefly in the article, just noting this now that this is yet another complicating factor to treating these NTM infections. The bulk of our paper really is focusing on reviewing of pharmacotherapy considerations for select antimicrobial agents commonly used to treat these non-tuberculosis mycobacteria. Several of the medications that are used for NTM therapy are not formally approved by the FDA for this purpose and may lack controlled clinical trial data in this setting. With the slow growth of mycobacteria and the potentially lengthy duration of therapy required, standard pharmacokinetic principles for more ordinary infections where we treat someone for 5 to 10 days may be drastically different. Therefore, you will notice that the dosing schemes may be different than standard dosing. These patients require multiple antimicrobials for months to a couple of years even, and this idea for patients and providers can be daunting with difficult dosing schemes, drug toxicities, and even perhaps the cost. As an example, there is limited literature supporting once daily linezolid for NTM rather than twice daily dosing, with some efficacy and hopefully improved tolerability in terms of the peripheral neuropathy and the myelosuppression. We focused our paper on specifically outlining dosing and clinical monitoring approaches based on nationally published guidelines, as well as what our institute does based on our expert consensus. We wanted to review some of the common syndromes seen with NTM, review the medications and dosing strategies that are literature-based, and if no literature is available, expertly recommended by our infectious disease colleagues here at Mayo Clinic. We also focus on what monitoring should be undertaken while on these antimicrobial regimens. We've included several nice charts to summarize our recommendations for duration of therapy, to drug dosing, and monitoring. But we also included text to review some of the reasoning in more depth, and also to discuss some of the controversies in treatment and our approach to them. We hope you find this a good resource when you encounter these challenging patient cases.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.